All right, we'll see who else comes in. Thank you for sending me this slides. We got those on hand if there are any issues, and I think we're ready to go.
And we're recording.
Okay. Yes. How's everyone's afternoon?
Lovely.
Yeah.
Good.
Very good convening.
Yeah.
Yes, it is. Hey, Bob.
Oh, it worked.
It is. Yeah.
I think this is the scariest part of the whole thing.
It's that Star Trek dissolving and reappearing thing.
Oh, man. I
You
can't
never
tell
know
you
if
how
you'll
many
get
times
back.
I've wound up in another galaxy.
Exactly. Right. 1, 2, 3, 4. Okay.
Surprised we don't have more people yet. This is such a hot topic.
I know. Well, I see that there's still 24 people, right? Still not assigned. So
Oh,
I don't know at what point do we know they've completed our group. They're still dropping in. And it's already 2:05. Okay.
Is it too
Tammy,
late to
how are
charge
you?
admission?
I'm good. How are you? Missing
No,
yoga
Bob.
with you.
oh, I like your mask.
Oh, thank you.
Tammy.
I'm feeling seasonal today.
Tammy, thank you for being here. Bob, to answer your question, no, there's no limited admission.
No, I wanted to know if we could charge admission.
Oh, that might limit the admission. That might limit the people who come in. So, okay, we're still 19 people to be, maybe they haven't chosen.
Did you have an estimate ahead of time how many had picked this topic?
No, they didn't give me an estimate. Probably because they knew people might change their minds today. But with the 4 of us, I believe that means we have 6 participants, but 2. Here we are. Okay, well, I'm gonna, so we don't have dead air time, and hopefully others will continue on into this session. But I want to thank you and let you know that you have joined Advocacy in the Housing Elements Updates. And that's the session you're in, so welcome. And we appreciate that you selected our topic. And as I open this session, I know some of you, but if you would put, oh, we have to admit, here we go. Terry, are you seeing the admit button?
They were admitted.
Oh, okay, I'm gonna let you do that so I can
Yeah.
continue. Thank you, just making sure. So as I open this session up and share what our format will be today and what we're gonna cover, if you could just put in the chat your local hometown, that would be terrific, and I'll use that information later on today. I am Sarah Robinson. I am the Marin County Coordinator for the Age Forward Framework. That is a county plan that allows me the privilege of working with our departments and the agencies and the community at large to incorporate age and disability friendly lens into all that the county is doing, all their policies and programs, helping them to enhance those programs and policies that are already serving older adults and helping them to think of possible new ways they can reach out to our residents. So like many of you, I'm working to create a county where all are respected and valued and supported, which is what we've been hearing about all day today, and where everybody has a voice in the process. So I'm a resident of San Anselmo, and so it's my pleasure to really moderate this session today. Terry Dowling is my helper here. Okay, just seeing, okay, sorry, I was checking the chat. And thank you so much. Terry, keep us on track time-wise if you can a little bit, keep that in mind. I will too. And got a timer right here. And there will be opportunities all through this session to ask questions. By the end of the session, what we hope you will have learned is what the housing element is, what the safety element is, why both are important, how our county and the municipalities are preparing for this planning process. We hope that you will better understand the whole process and this that takes place, I believe, every 8 years. But more importantly, at the end of this, we want you to hear our call to action. Throughout the day, we've heard how our voices need to be added to those that are out there on so many different issues affecting older adults and individuals with disabilities. So this is yet another call to action, and we will give you the resources and the information today so that you can advocate in the way that you feel most comfortable with the county. You can advocate on your local level as well. But we really need to ensure that we speak up in this process because we're planning, it's a long-term plan that will address our local housing needs. And so today we'll also talk a little bit about the supports and services that individuals need related to their housing as they age, and housing options that are available, but what we may not have enough of. You heard Supervisor from Solano, Supervisor Brown, mentioned earlier today. She talked about housing and affordability, and even geographic or location concerns that she learned about in learning about the planning process. So we'll talk about those today. Our theme today is resiliency. I'll just remind you, you probably have that drilled into your brain now, but resiliency and aging is going to be woven through our conversation. This is our season of red flag days, fire risk, and local hazard awareness campaigns are taking place right now. So you'll learn how the county safety element planning addresses climate change resiliency too. We won't leave out the fact that all of us depend on the hard work and the sacrifice and the special skills of the individuals, many who are immigrants and refugees, who work in special services, work in caregiving, who can't even afford to live in Marin. Their long days and their nights come with a tiresome commute, extra time away from their family that is really unnecessary if we had more housing, few benefits, and low salaries. So the shortage of affordable housing for them is creating a caregiving crisis, and for them and for service workers. So I'll remind you that what we learned today from Diana Lopez when she covered the master plan is that the goal, one of the bold goals is on housing, and it's that we will live where we choose as we age in the communities that are age, disability, and dementia friendly, and climate and disaster ready. And that we will have, another goal is that we'll have economic security as long as we live. All this is tied together today in our discussion. We'll have three notable speakers today. Each will spend some time sharing with you. And after one finishes, you'll have time for questions or comments. And then after all three have spoken, we're going to join together in a bit of a panel discussion, still taking your questions and comments, but blending our conversation together. So again, we hope you'll become advocates by the end of this hour or 70 minutes, and start thinking right now about, for you, what is a livable community? What is age-friendly for now, for you, and for your future? Our Supervisor Brown said this morning that sorry, just drew a blank, but she said that for her, a livable community means building near schools, so that older adults can have more intergenerational opportunities with youth. And so that's just one thing to be looking at as we talk about planning. So with that, let me first introduce Bob Pendelay. He comes to this discussion with 40 years of city planning experience. He has worked locally in Corte Madera, San Rafael, Solano County, Vallejo, Sausalito, and Fairfax. He has lived in Marin since 1989, and he currently serves in the Marin Environmental Housing Collaborative. So we're so grateful that he is continuing his education in this county today on the housing element, and we're grateful for his presence on this panel. So Bob, with that, we'll turn it over to you.
Okay, well, let me see if I can share my screen here. Looks like this is going to work. Okay. Can you see this?
Yes, we can. Thank you.
Okay, great. Okay, so I'm going to talk about how we can get senior housing built in our communities. I'll be focusing on the local planning process that happens at your town hall. So why do we need to get to yes? Well, I think this audience really knows, but I'll talk about it anyway. Oops. Okay, there are a lot of seniors in Marin County, and there are more on the way. By 2025, 28% of us will be over 60. 10 years later, it'll be 48%. And by 2040, the population over 80 years old will have doubled from 2015. So what do seniors need? Well, the majority of us own our own home in Marin, but as time goes on, that 3- and 4-bedroom house becomes just too much for some of us. It's more maintenance than we want. It's just not the way we want to live anymore. So we need options to downsize. As time goes on, accessibility can become an issue at your home. You may need ramps, grab bars. You need a solution to the stairs to the second floor. And we want to be sure that your building department down at Town Hall is user-friendly. They need to think about programs especially designed to the needs of seniors. For many of us, as we get older, our income goes down. And in fact, at least 5% of our seniors live in poverty. And so there can be a need for age-restricted affordable housing, especially rentals. But as time goes on, health becomes a bigger factor in our housing. So some of us need congregate care facilities. There's a need for licensed facilities, memory care, and finally skilled nursing homes. So seniors have very distinct housing needs. Let's see who I am. Okay, so I'd like to suggest that there are 3 ways to get to yes on senior housing. I'll talk about the housing element, something called the annual performance report, and then the actual project approval process. So let's talk about the housing element. I'm sure you know that every city and town and the county is also required to have a general plan. They have a variety of chapters. Each chapter is called an element. But one of these is the housing element. And it has to have an analysis of housing needs in the community, the constraints that are out there towards meeting those needs, policies and programs to overcome the constraints and actually address the needs. And in particular, they have to identify actual sites, properties that have the potential to provide additional housing to meet something called the RHNA numbers. I'm going to explain RHNA in a minute. But the bottom line here is that the city must zone enough land to accommodate the identified needs and especially the RHNA numbers. Unlike the rest of the general plan, the housing element must be updated every 8 years. We're near the end of the current cycle. The next cycle begins on January 15th, 2023. And at that point, every city, town, and the county must have adopted a new housing element. And that housing element had to be approved by the state. The State Department of Housing and Community Development is in charge of enforcing the requirement to have a housing element. So a minute ago, I talked about RHNA. That's the Regional Housing Needs Allocation. It comes to us from the State Department of Housing and Community Development and the Association of Bay Area Governments. Now, the RHNA is the number of units that your jurisdiction, your city, your town, and the county have to actually plan for. And it's broken down by income categories. very low income, moderate income, and above moderate income. Over the past few months, the county and the various cities received their RENA allocations, and here's what it looks like. At the low end of the scale, City of Belvedere is going to be required to plan for 160 units. At the very top, the county is going to be planning for almost 3,600. Some other notable numbers are San Rafael at 3,200 and Novato at almost 2,100 units. So the RENA numbers must be addressed in the housing element. This means, for example, that Corte Madera is going to very explicitly plan and show how they can provide for 725 units over the next 8 years. Let's see, where are we? So what are the leverage points in the housing element that can help you to get to yes on senior housing? Well, first of all, your city council is going to most likely approve a citizens advisory committee. Ideally, it's a cross-section of the residents, and they'll be charged with working with the city staff and coming up with a draft housing element. Now, ideally, you can get on the advisory committee, then you're going to have a lot of leverage and influence on the development of the housing element and its contents. But even so, all of their meetings will be open to the public, and at each meeting, there'll be time for public comment where you can speak up and say, advisory committee, you guys are doing a great job, or you're really dropping the ball. I'd like to see this specific property identified for senior housing. Ultimately, when the advisory committee finishes its work and delivers its draft element, goes to the planning commission and the city council for public hearings. Probably, as you know, all of those hearings are open to the public, and everyone who wants to will have an opportunity to comment. So tell the city council what you like in the housing element and what you don't like and what you'd like to see for changes. And most important, you want to be evaluating the policies in the plan. Do they make sense? Do they really address seniors' needs? And be prepared to comment. Are the sites realistic? You know, if you're 10-story high rises in the open space, it's really not realistic. And what you ought to be prepared to think about is maybe 3 and 4 stories downtown with housing above residential. This could be a real opportunity for affordable housing. But the sites, bottom line is the sites need to be realistic. If things get tough, advise the planning commission and the city council that there are penalties and there are enforcement mechanisms that are available to the state. And finally, the draft housing element has to be forwarded to the state of California for their comments. And the final element has to go to back to the state for their approval. And California Housing and Community Development wants to hear from you. So be prepared to forward your comments. You have leverage. Okay, second point of leverage is something called the annual performance report. Every year, the city council is required to prepare a report and submit it to the state. And they have to tell the state how many units were applied for in the past 12 months, how many got approved, how many actually got built, and at what affordability levels, and are they meeting their regional needs allocation? So how have we been doing? Well, this past year, we reached the 75% point. We were 6 years into the process. And here's what the reporting data shows us. Corte Madera was doing really well, especially with market rate housing. They'd met 700% of their goal, but they were doing really well in the other categories as well. If you figure 75%, which is where they were in the cycle, it's right about there, they were pretty much on target. And so was Mill Valley. Again, they're at about the 75% level with everything. San Rafael, which historically has had a lot of success with housing, is having a tougher time this cycle. I would say they've made a lot of changes in the past 6 months to hopefully improve their performance. And you can see it, Tiburon is lagging. So what's the leverage point in the annual performance report? Well, one to think about is SB 35, a state law that applies to cities and counties that aren't meeting their regional housing needs allocation. And if your city isn't doing a good enough job with RENA, you might want to remind the council about SB 35. Because what that says is that projects that are in the range of 10 to 50% affordable get automatic approvals. No public hearings at the Planning Commission or the City Council. They apply for the building permit and it must be granted within 90 days. And statewide, we have something like 300 cities in California. And at this point, there are only 28 cities that are actually exempt from SB 35 that are doing well enough with ARENA. And interestingly, 2 of them are here in Marin County, Mill Valley and Corte Madera. So good on them. And finally, a third place where you've got leverage is the project approval process. When you, on a good day, you hear that there is an application pending for an affordable housing project in your community, what's your leverage? Well, first of all, you want to know what you want. What's the minimum that's acceptable to you on this particular piece of property? And are you sure it's really going to be affordable? Who's sponsoring it? So what are the likelihoods of success? Know what you want. Then organize. Get together with other like-minded people who are prepared to speak up and speak as a group. Then testify at the Planning Commission. Tell them what you like and what you don't like. Lobby the elected people. Send a letter to your city council member. Ask to visit with them in person. Telephone them. Tell them what you like about the project, what you don't like about the project. And if you're not satisfied with the Planning Commission, give the elected folks an earful. And finally, testify at the city council hearings. When the project comes up for approval, the public hearing will be advertised and you must be allowed to speak. So we can get to yes on senior housing. A couple of avenues are the housing element, the annual progress report, the project approval process. If you'd like to learn more about affordable housing and the housing element, you might take a look at our website, marinmec.org. If that's a lot to remember, just Google MEHC and you'll find us. Thank you for your time.
Bob, thank you so much. And we did put Marin MEHC's website in our resource list, which Terry will post a link to. We have the web links on many resources for your advocacy, and we'll make sure you have them in the middle and at the end of this presentation. Bob, and if our participants have any questions for our speakers, please feel free to put them in the chat, or even just put the word hand in the chat, and we'll make sure, Terry will make sure we call on you. But I have a question for you, Bob, because you've been in planning, city planning for so very long, and you've seen these element processes come and go for many different locations. You referenced that there are certain policies that we should be asking for to help our local elected officials or the county meet these goals in these processes and to fulfill the needs that these assessments show that we have in our community. Over your career, what types of policies have you seen, effective policies have you seen developed either during or after this kind of planning process that have made a real impact?
Well, things have changed so much in the past 10 years. I mean, it used to be the housing element would be assigned to maybe the most junior person in the department, and that poor soul would lock themselves in a room for 6 weeks and draft the element, and there might be an advisory committee. Today, it's taken extremely seriously because of changes in state law. SB 35 is really just kind of the tip of the iceberg. Now it's possible for, if you have an inadequate housing element, if you refuse to produce one, you might find yourself without transportation funds from the state. I would say that one community that shall not be named at the moment here in Marin County a number of years ago was not doing well with its housing element, and a judge ruled they could not issue building permits until they adopted a new housing element. And there was a lot of energy. And what came out of that was a very nice family housing project, 76 affordable units, but it was a direct result of enforcement actions. So, I mean, to me, the big picture answer to your question is that housing elements are now very important and are really being enforced. Relevant policies, and thinking about this talk today, it occurred to me that many building departments could be more user-friendly to seniors. You need, somebody in my neighborhood has put a stair elevator in the house, it needs a building permit, it needs an electric permit, structural permit, so on. We have a very good building department where I live here in San Rafael, but you want to have that inspector really caring about providing good service to the seniors and understanding that maybe it needs a little bit more explanation. Maybe the lady who lives there just is not real familiar with construction terms and doesn't understand why this and that is being required and so on. So, I'd like to see a housing element policy that makes the building department more user-friendly to seniors.
Mhm. I've noticed we have quite a few gerontologists, and obviously with Dr. Aronson, a geriatric doctor, on today's convening, and I think that kind of training, obviously not at that level, but for contractors, for housing planners, city planners, I think you're right. I think we need to bring some education on the needs of older adults to all of those involved in the planning and building process. I think that's a good idea. I'm going to move on. I have another question for you, but I think I'll save it for our group panel. Thank you so much. And let me go ahead and introduce our next speaker. Jillian Zeiker is our senior planner in Marin County at the Community Development Agency's Housing and Federal Grants Division. And she's got 9 years of experience in urban planning, landscape architecture, urban design, and she's another wise voice in this conversation. She's working at the county level in this housing element process. So that would be working for the unincorporated areas throughout Marin and housing in those places. And she's worked in the Bay Area for most of her career. So Jillian, welcome. Thank you so much for being here.
Thank you. Let me pull up my presentation. Thanks, Bob, for that great introduction to the housing element. I loved your talk on RENA. You explained it very well. I think that it can be a difficult concept. So today I'm going to talk about housing elements in Marin County. I'm going to focus on the countywide housing initiatives and discuss our unincorporated Marin County housing and safety elements, and then how you can get involved in your city or town's housing element. So we have some countywide housing initiatives. The county received funding from ABAG, our regional planning organization, to do some work countywide. And we met as a group. We actually meet as a group. The planning directors of all of the cities and towns in Marin County have been meeting for a couple of years to discuss housing issues. Several of the jurisdictions don't have a dedicated housing planner or housing planner staff. So we help in that respect. And we collaborated on our accessory dwelling unit website, adumarin.org. And we've also collaborated on other projects, including objective design standards. But today I'm going to talk about the housing element projects. So the housing element projects that we collaborate on are first, the countywide website. So I was hoping this website would be published today. I'm having some technical difficulties with our website designer, but I would check back tomorrow. It's housingelementsmarin.org. And this is a central website where you can find all the events and the meetings throughout Marin County. So if your city or town is having a meeting, it'll be on that website. There's also general housing element frequently asked questions. So if you want to learn a little bit more about RENA or potentially the penalty, if your jurisdiction doesn't pass a housing element or any other more technical questions, you can go there. We also have a website for the countywide fair housing work and links to each jurisdiction's project updates. So each jurisdiction has a project page on the website that you can click on and it'll take you directly to their housing element website. So I just wanted to give you a little preview of the website. You can join the conversation yourself. It's a quick button. You can register. If you're not sure what jurisdiction you live in, we have a really handy tool. For instance, some people, their address may say San Rafael or Novato or even Fairfax, and they find out that they're in unincorporated Marin County. So it's always good to check. And then you can click directly in our upcoming events to watch the meetings. Our second big initiative is countywide fair housing initiative. So part of the new housing element is a requirement for fair housing, which is called in its more technical terms, AB 686, which was a state bill that mandated these fair housing policies be part of all of our housing elements. So we're working together on this. We have experience doing something similar. Our analysis of impediments that Liz Darby, one of our staff members at CDA, worked on for several years. So one of the first initiatives that we're doing is outreach to those who are least likely to attend our community meetings. And those who are least likely to attend our community meetings are typically people who speak English as a second language. So this includes funding for translation, but it will also include a mapping exercise to see which areas of your city or town have rent burden, which areas have changed over time, which leads to demographic analysis. So each city and town is going to have demographic analysis conducted over time that it will include trends like race and ethnicity, age and income, and it'll help each jurisdiction figure out who do they need to plan for in the future. As Bob said, there are RENA requirements, and you saw all of the jurisdictions have a number of housing units that they have to put in their cities and towns. Part of our work will be equitable analysis of the sites. So are all of the sites being placed right next to the freeway? Or are the sites being spread out in the different neighborhoods so that we don't have pockets of segregation? And finally, meaningful actions. So programs and policies. And I think this is really important to the older adult community because when we plan for housing, we plan based on income. But when we look at programs and policies, we can get into the protected classes. And as you all know, age is a protected class in California. Now I'm going to talk about the housing and safety elements in unincorporated Marin County. So we have decided that we're doing the housing and safety elements together. I am not taking on the safety element. That will be in our long range planning division. So I will speak a little bit on behalf of that, but I have some contact information if you want to hear more about it. So components of the housing element, just to kind of go over this again, we have a needs assessment, which we're currently doing. We're looking at demographic trends, we're looking at the housing market, but we're also doing focus groups. One of them is going to be with older adults, but we're doing focus groups with ag workers, we're doing focus groups in specific geographic areas. And then we look at all of our previous accomplishments. So how have we implemented our previous housing element, kind of using the information that Bob was talking about with our annual progress report. Where are we not building housing in terms of income levels? And then looking at our constraints to housing development. So as Bob said, is our building department's website difficult to navigate? Is the market difficult? Is land too costly in Marin County, and that's why we don't have developers here? Environmental issues, and this is where the housing and safety elements will fit nicely together. We have sea level rise, we have earthquakes, we have wildfires. So how do those constrain housing development? And finally, infrastructure. A lot of the unincorporated county is on septic and doesn't have gas lines. So how will that impact housing development and multifamily housing development in the future? Keeping all of that in mind, we will plan for our sites. So planning for housing for over 3,500 units in Marin County unincorporated, where are we going to plan for those? And looking at how we can develop and nurture our public-private partnerships and look at our financial resources. And finally, affirmatively further fair housing. And that's what I was referring to in the countywide initiative. So there are 5 categories of analysis, and we need to make sure that we distribute the extremely low, low, moderate, and above moderate income in all of our arena sites equitably. And then finally, meaningful actions, which are programs and policies that I discussed previously, but they have to be very specific. We can't say we want to create more housing for older adults. We have to be specific and say we want to create X number of units for older adults by 2025. We have to be very specific about that. So upcoming housing element activities. In the near future, we're looking at and evaluating all the potential sites. We're reviewing our zoning and policies to see where additional housing can be identified, if we need to do any rezoning, and also continuing to involve the community and receive input. So I will talk a little bit more about how to get involved in our housing and safety element, but I do want to give a brief, kind of a brief summary of the safety element. So the safety element is also part of our countywide plan, which is the unincorporated county's general plan. And these policies are included throughout the countywide plan. There isn't a specific safety element chapter of the countywide plan currently. But the safety element contains the county's plans to prepare for and protect from essentially all the harmful impacts of environmental hazards, and also to proactively plan for climate change. So you see in the pictures here, but wildfire, flooding, landslide, sea level rise, drought, extreme heat, you name it, the safety element will plan for it. So there's obvious reasons for why we need to update it, but it's really driven by recent state law that connects the updating of the housing and safety element. And staff at the county thought it was logical to do them together, since climate change and resiliency planning have such an important link to housing. So this update really focuses on climate change and resiliency planning and planning ahead, and not really planning for the after effects. My counterpart, a senior planner in our long-range planning division, Leslie Lako, is heading up this effort, and I included her email here. I spoke with her before this conference, and she said that she's happy to receive any questions that you have. And here's just a little look at our timeline. So right now we're having meetings and workshops. We had our first workshop on September 22nd. We're having our next workshop November 15th. We have surveys coming out. We have online surveys coming out. Then we're going to identify our potential sites and do environmental analysis that's mostly related to the safety element. And then we'll present our draft housing and safety elements in the spring, summer of 2022. And then all of this has to be approved by our Planning Commission and Board of Supervisors before January 2023. So given all of that information, I'm sure you're wondering how you can get involved. So I'm going to talk a little bit about how you can get involved in unincorporated county, but also how you can get involved in your city and town. So in unincorporated county, we're going to have a print and online survey in English, Spanish, and Vietnamese, and that is coming out in mid-October. It's going to be a Survey Monkey. And then we also have this great web tool called Consider It that has you consider statements around. So this is going to focus on safety. Our print and online survey is going to focus on housing need. And then we have our community workshop, the second one. I have early November here. We just finalized it today as November 15th. And then the housing and safety element teams are going to be presenting at a joint planning commission board of supervisors meeting on December 7th. We will have a large list of sites to discuss at that point. And how can you get involved in your cities and towns? Well, I'm working with the planning directors, and you'll be able to see on their websites. They will be doing focus groups. I'm actually going with Liz Darby to council meetings at all of your jurisdictions to talk about fair housing and our restrictive covenants program. Each of the jurisdictions are required to do public workshops. They may also have surveys. I encourage you to go to their websites to sign up for updates, but also if you have comments and questions, send them to your city and town staff, because they'll either be able to answer them, or if they're working with a consultant, they'll be able to get you an answer. So just some helpful links here. Our website is marincounty.org/housing and housing safety elements, and then the overall countywide website, which like I said, is unfortunately not running right now, but will hopefully be running in the next 24 hours, is housingelementsmarin.org. So thank you, everyone.
Thank you so much, Jillian. And thank you for all the upcoming time you're dedicating to our towns as well, the county process as well as fair housing. So thank you. One question before I go on to Dan. It's been, people are curious about what resources do the consultants involved in this process and the county staff. You talked about, using demographics, but what resources do you dive into in this process, the planners, to learn about, beyond the census, learn about the local population needs, assuming, but beyond your surveys?
I can't speak for the cities and towns, although I assume they'll do something similar, but we've been doing focus groups throughout the fall with renters, homeowners, Spanish speakers. We're doing some with ag workers. We're doing specific outreach in West Marin for some communities there. We also have a stakeholder committee that is composed of people throughout the county. We're using them as a focus group for our next meeting. So we're really diving into these interviews. We're also interviewing employees, educators, and environmental groups.
Thank you. And are there any areas in the county opportunities for funding affordable housing for older adults?
Yeah, so our housing trust fund is a great tool for developers. We also have funds through it's a state fund. It's called PLHA. I don't remember what the acronym stands for, but those are matches for our housing trust fund. So we funded Victory Village. I think that the county gave around $7 million for Victory Village. And that was all through our housing trust. So if there are, if there's an acquisition that you know of, if there's an apartment building going up for sale that you think would be great for senior housing, and a developer is interested, that's a way to get it through the housing trust. And who knows, in the future, we will probably have more funding from the state specifically for housing for older adults, and that will be administered through the Housing and Federal Grants Division.
Terrific. That's all good news. Thank you so much for sharing ways that our participants can get involved, not only at the county process, but the local process. you've made it very clear that there are multiple places that we could share our voices and participate. So I encourage everyone who's participating today or listening in or watching this later to please take a good look at those opportunities. Thank you, Jillian. I'm going to go ahead and introduce our third speaker. Dan Steckline is our program coordinator in Marin County for our long-term care ombudsman program. And while he began in that program in 2012, just this year, he became our first unit supervisor and program coordinator for that program after a realignment of supervision there. So we were really excited to see him take the charge of this program. He brings years of experience and a master's in gerontology focused on nursing home culture change and person-centered care to this role. So Dan, thank you. Will you share with us, share your knowledge with us that would inform this process?
I'll start with unmuting myself. Yeah, let me share my screen here. Can everyone see that okay?
It's not in slideshow. Yeah,
How about that?
great.
Yeah, thank you very much. I'm happy to be here. And originally I was not sure why I was here, just because, you know, licensed long-term care, you know, it doesn't necessarily show up on RENA numbers, or oftentimes long-term care facilities are kind of viewed in this siloed way, you know, apart from the rest of the community. But the more time I've spent in the program, the more I realize that there really are no silos. It is all interconnected. And the Ombudsman program, we actually have a pretty unique view of housing because we are working with residents who are on all ends of the spectrum, either trying to get out of their housing into long-term care or trying to get out of long-term care back into some form of housing. So we're going to get into that a little bit here. Just real quick, our Ombudsman program, we're housed within our Aging and Adult Services, which is a part of our Health and Human Services here with the County of Marin. Other counties might have an Ombudsman program as a nonprofit, or you know, not being a part of the county structure. So we're very lucky in that way here in Marin County, because we can be connected to all this amazing local public health, emergency operations, response programs in the work we do. So just in case you're not familiar with our program at all, we're advocates for residents in licensed assisted living and skilled nursing facilities. Our jurisdiction does expand a little bit when it comes to allegations of abuse. We do receive all those from mandated reporters regarding residents who are living in the homes for the developmentally disabled throughout Marin County, or the adult daycare, adult healthcare, that sort of organization. A big part of what we do is provide information and assistance. A lot of it has to do with resident rights, regulations, especially during this pandemic. It's been very challenging. So we are oftentimes a good source or resource for information about the long-term care setting. But people also come to us with questions about, you know, what do I do? I'm in home, it's not working out. My mother, my father, my whoever, what is the long-term care setting like? And so basically, kind of in a nutshell, there's independent living with in-home support. That's one kind of usually the first step. People want to stay in their homes as much as possible. Other people might want to go to assisted living communities or have to go to assisted living communities for additional care or meals, different things like that, housekeeping. Some have memory care. And then Bob also mentioned nursing homes. And I'm going to touch on briefly continuing care retirement communities. You know, the in-home support, you know, there is, it may start with family members. If you're lucky enough and you have the resources, you can hire private caregivers or home health care agencies, home health and work with home care agencies. There's also, for those that qualify for Medi-Cal, they have available to them some in-home supportive services that can provide a certain level of support in the home, personal caregiving, that sort of thing. And then Marin Center for Independent Living also has a caregiving registry, which has been very popular, matching caregivers with the people needing it. But then going outside the home, there's really, for those that are just wanting sort of that next level of care, not needing full-on medical care, the official term for assisted living is called residential care facilities for the elderly. And that basically is called assisted living, board and care, or residential care facilities. These are all licensed by the state of California. Primarily, they're for personal care, some medication management, housekeeping, meals, activities, transportation, that sort of thing. You can live in assisted living and you can own a car, you can have a job. It is in some ways a choice, a lifestyle choice, although some people need it. Some of them have a separate memory care area for those that need a little bit more supervision or a little bit different type of activities. And then we have a few here in Marin County that are all entirely a memory care building. The big catch about assisted living is it's private pay. It's private pay, or if you have a long-term care insurance policy, if you're showing that you need some assistance with an activity of daily living, that policy may kick in. So our small board and cares, we have 29 of them in Marin County. They're basically a home in a residential neighborhood, 4 to 6 rooms that have been converted to be a little sort of miniature assisted living home. You're not likely to have a private bath just because of the nature of the structures. And some of them do offer shared rooms for a little bit of reduced cost. The staffing ratios in these environments can vary greatly. One little board and care might have 1 or 2 staff, and they kind of accept a resident with a certain level of care needs. And then others might have 3 or 4 staff members on an AM shift. And most of it's like walking into a small nursing home with everybody needing total assistance. So the larger or medium-sized assisted living units, these are going to be where, again, they might have a nurse as a part of their operations. Maybe there's some slight additional medical services available. Maybe they might be able to give shots for insulin, something like that. Or some might be able to work with pureed foods where others may not. It's important to look at the fine print. And then some of those, like I mentioned before, also have memory care. And really these are where people can move into these almost for the socialization, for the activities, for the lifestyle, if you will. And then the same goes for our larger communities where you have individual apartments with kitchenettes, and it can be almost like living in a resort. They have indoor pools, that sort of thing. Maximum socialization activities. And then nursing homes, I think we're all familiar with those, but that's primarily licensed to provide medical care. There's short-term and long-term care options. And so this is certainly one of the few places where somebody that needs 24/7 supervision and they qualify to be in a nursing home, that Medi-Cal would pay for one to live in a nursing home long-term. So oftentimes that's the only option for people financially if they do qualify, because assisted living, you're looking at a minimum of like $5,500 in assisted living up to like $10,000 a month, which not everybody can afford. So nursing homes, yes, Medicare will pay for short-term coverage, and then Medi-Cal for those that qualify for long-term. And then our continuing care retirement communities, those are that sort of, they really offer that continuum of care. So they would offer independent living, assisted living, usually memory care, and then also the skilled nursing. The catch with that, though, there's usually a substantial financial investment, although each CCRC varies in how they structure their contracts. And even like the Redwoods, it's not really a continuing care contract. They're licensed individually, they're assisted and skilled. So you would need to be applied again in each one. But typically the beauty of a CCRC is you buy in and then you don't have to worry about your future. In Marin County, we have 3 of those continuing care contract CCRCs and then the Redwoods. So a total of 4 in Marin County. You know, I mentioned before, we have a unique position here because we're sometimes working with family members who are trying to find placement and also trying to get people back into homes where they maybe have a diagnosis of needing care 24/7 or supervision 24/7. That's a tough diagnosis to satisfy at home just because of the amount of labor that would cost unless you have a family member that are able to do that. So there's been a shift because I think everybody is unhappy with nursing homes on all levels. I think there's just this shift for more in-home care, this shift away from that more institutional type of living. And so a consequence of that is there are no new skilled nursing facilities really being built much. Occasionally you'll have a new CCRC being developed somewhere, and that might have a small nursing home for that community. But overall, certainly in Marin County, as long as I've been around and in the near future, I'm not expecting there to be additional skilled nursing facilities developed. So there are not that many options for affordable assisted living. There are quite a few options for the sort of full service assisted living. Like I mentioned, the cost of that is anywhere from $6,000 to $10,000, $11,000 a month. And so I think that supply and demand, there's plenty of developers willing to do that. If you're looking at that type of housing, we do have some recent developments here across the freeway from the Civic Center. There's the old Hudson Street design is being developed or almost completed, first part of next year. We had the Hamilton project in Novato. I think there will be one eventually in San Rafael. So I think for that type, that supply and demand is working for the people that have that income. But the real problem here is that lack of affordable or very affordable assisted living. And when I say lack, I guess I probably should say no affordable assisted living. By affordable, I mean, we have residents here who live on $700 to $1,500 a month. We have residents who call us or their friends call us, they were living in a boat and their boat has been condemned or demolished. Where are they going to live? They have maybe some needs. They probably need assisted living at this point. Where can they go? We really don't have anything to tell them. Short of people being able to qualify for a nursing home under Medi-Cal, or if you have a home where enough support can be provided through in-home supportive services or combination of in-home supportive services, family and friends, that's really the only options available at this time. So we are, my long-term care field, we're very associated with housing. And what we see is a real need for very affordable housing. The people that are homeless oftentimes go to the hospital and then they come into nursing homes, and then the nursing homes are required to provide a safe discharge. Really hard to do with someone who's homeless. So that connects then that nursing home to the community. And the Ombudsman is doing a lot of work in this area to break down that silo, connect community people, agencies that work with the homeless to find housing, find other types of case management, and get them reconnected while they're in the nursing home before they go out, so that they don't lose any ground of the care and how well they've been doing. So with no more Medi-Cal beds being developing, you saw the numbers of increased populations, older adults. What's that going to do to our Medi-Cal beds in this county if they're not building new skilled nursing facilities?
Dan, let me interrupt here and bring in for the last few minutes we have 7 minutes left, and thank you so much for giving us that vision of what is available and not available for people who need services outside of their home. We should also let our participants know, one thing I learned this week from Jillian and Bob is that these facilities are not considered part of the units of RENA. Correct me if I'm wrong, Jillian, but if a building with services was built for this long-term care, that wouldn't qualify in our RENA numbers, correct?
Correct.
Right. So that's my way of saying that we have the housing element process, which will bring us affordable housing. Perhaps we need to look at, based on what we've heard today from in the last session, we need to consider multifamily housing throughout the county, considering the cultural needs of different groups who want to stay together in extended families. And they may need some affordability there as well. And then there's that tension between those that need in-home services, but that comes at a huge cost, and they may not have the resources to go to one of our skilled facilities. So I guess we have just a few minutes, and I'd like to just ask all of you, with these constraints, we've got we know what older adults need, but there's some constraints in this housing element process. I would assume also the developers who come to our county are interested, as you've alluded, Dan, in certain types of projects, maybe certain types of categories in the RENA sections. Can you speak about how we can advocate in ways that will help address those constraints, be it developers who aren't interested in certain projects, or helping, open space that if units are placed there, that creates a transportation barrier for older adults and/or infrastructure issues. And then of course you have the safety element, the concerns about are the sites we picking safe based on the various emergencies we have here in Marin. So would any of you like to speak to some of those barriers and how we can address those? Bob.
Well,
Thank you.
one thing that occurs to me is in the past year, I've been to a number of housing hearings in San Rafael as they wrestle with their regulations, trying to find new ways to incentivize housing. And the mayor always speaks to what I think is a fair issue, that they've approved recently one, I'm not sure which type of care facility it falls into, but an Oakmont project that's under construction that Dan just referenced. And then they have another one on the books that's about to get its building permits, and they're very happy to have them, but they don't get credit against RENA. And I think one change to state law that would help would be if the regulations were changed so that the cities did get credit to that for approving units made a very real housing need for seniors, but doesn't count in terms of the whole housing element bureaucracy. It would give the firms that are able to develop these kinds of facilities a little bit of a leg up, and certainly an incentive to city councils, boards of supervisors to make zoning provisions to encourage them.
Thank you so much, Bob. And how do we look at reconstruction in this process? Reconstruction opportunities, malls, new urban subdivision.
Well, it's certainly topical right now in San Rafael, where they're looking at Northgate Mall, and again, no real incentive to the developer in terms of zoning compliance, general plan compliance, to provide for a care facility in there, even though there's a really desperate need, and it'd be a great location with supporting commercial services and so on. But the developer has to look at this and says, well, how do I get to yes at the city council with this? There's no incentive for the city council, even though there is lots of goodwill at the council for facilities like that.
Dan, a comment from you and then we'll close.
I would like to, I'm just wondering as far as advocacy, when some of these projects start in the planning stages, like let's say that Oakmont, I don't know who was all involved with that, if there's any way to get developments like that to have a certain percentage of rooms or beds that are very affordable as a part of that, allowing that project to happen.
In my experience, the answer is no. Had a really unhappy experience when I worked at Corte Madera. They'd approved a really nice senior care facility, and they'd put a requirement in it that something like 10% of the units had to be affordable. Turned out it wasn't.
Bob, we're about to close.
Oh.
I want time to thank you three. They're going to take us out to the main session in a minute. Thank you all for this. Thank you for the new website, Jillian. We'll make sure everybody gets that. And we've mentioned a lot of ways to get involved. So I encourage participants and viewers of this session to please look at the resources that have been posted in the chat. Thank you so much. It could have been even more rich discussion if we had more time. But it was great.
Hey,
Thank you.
Dan, I did have a question before we pop up. The medical waiver, there was a